Welcome back to halftime here at Inca High School, and all season long we've been partnering with Mission Health to learn more about the injuries that some high school athletes face, as well as the road to recovery after some of those injuries. And Dr. Myron Skip Smith III is an orthopedic surgeon with Asheville Orthopedic Associates, a division of Mission Health. And I want to talk about an injury nobody likes to see, knee injuries. Dr. Smith, how common are knee injuries?
Actually, knee injuries are quite common, unfortunately. They do account for about 15% of all injuries in high school sports. And they account for 50% of all surgeries that are generated out of high school injuries. So it's a pretty common injury.
What sports see the most knee injuries?
The most common sports for males would be football, soccer, and wrestling. And for females, that would be basketball and soccer.
What are some of the differences? I heard there was actually a difference between male and female knee injuries. Is that fiction or truth?
It is very true. And part of it's anatomic and the fact that females have stretchier tissue. So females much more commonly will have patellar dislocations where the kneecap pops out of place. They also have, if you look at the same sports, if the male and female participate in the same sports, females have a 4 to 6 times increased risk of ACL injuries or anterior cruciate ligament injuries.
So what should someone do in the event of a knee injury? How soon should they seek treatment, and what's the rehabilitation like in the process of recovering from that?
So if you're a high school student, fortunately we have trainers at most of the high schools, and Mission supports a lot of the local high schools with excellent trainers. And it's important to contact your trainer. They're a great resource in triaging or deciding how bad an injury is and what has to be done next. If they have an injury that crops up at home and you need to seek attention, of course, if it's a terrible injury where they can't bear weight or really deformed, then you can go to the emergency room. But most of these injuries can wait a day or two, and fortunately we do have a walk-in sports medicine clinic that is there from Monday through Friday during the day that you can walk in. You don't need an appointment, and they're staffed by sports medicine trained specialty physicians.
Great information. Thank you so much for joining us at halftime.
You're welcome.
That's Dr. Myron Skip Smith III, an orthopedic surgeon with Asheville Orthopedic Associates, a division of Mission Health. Let's go back to the booth.